Hi, everyone, and welcome to our first interview on the ISPD Expert Series. I'm Soumya, your host, a medical student with a passion for pediatric dermatology. Follow our page for more PedsDerm information, interviews, and up-to-date tips from the world's leading pediatric dermatologists. Our first interview on the series is with the president of ISPD, Dr. Amy Paller. Dr. Paller, thank you so much for coming in today, and I would love to know where you're zooming in from.
I'm zooming in here from the city of Chicago. You can see it in the background.
Awesome. All right, so we're just going to go for the few questions. So why don't you start by telling our followers a little bit about yourself?
Sure. I'm currently the chair of dermatology at Northwestern University here in Chicago. And I spent 16 years before that as the head of pediatric dermatology at our Lurie Children's Hospital of Chicago. I practice pediatric dermatology and I run the department, but I also run a clinical trials unit focusing on pediatric dermatology and a basic science lab.
Great, awesome. So in terms of pediatric derm, I know you're well versed in a lot of topics, but if you had to pick three special interests, what would those interests be?
Oh my, I have so many interests, but without a doubt, my first and foremost is genetic disorders of the skin. I did my graduate work in genetics and have always had my eye on genetics. In fact, the whole reason I went into pediatric dermatology was because we could so beautifully see genetic disorders and make a diagnosis without any other testing often. The other areas that I pay a lot of attention to are a variety of inflammatory skin diseases. I would say particularly the inflammatory skin diseases like atopic dermatitis and psoriasis, and maybe the other group being the immune and autoimmune mediated disorders ranging from connective tissue diseases to alopecia areata and vitiligo.
Great. Yeah, those are really interesting areas. I know it's hard to narrow it down, but love it. So let's talk a little bit about ISPD. I know that you're our first expert sort of in the series. I think our followers would be really interested to know what was the vision of ISPD and sort of why was it created?
Well, I have to be honest in saying I wasn't there when the society was created. This was back in 1973 at the very first World Congress of Pediatric Dermatology in Mexico. And I'm afraid I was not yet anywhere near dermatology yet at that point. However, this has been an organization that has supported pediatric dermatology through this World Congress of Pediatric Dermatology for many years. We just celebrated last year our 50th anniversary. We've grown quite a bit as an organization. We're now having our 15th World Congress of Pediatric Dermatology coming up in April of 2025 in Buenos Aires. We have bounced around the world in our various meetings, and now we're back here in the Western Hemisphere. I would say that this is an organization that has always had its eye on helping to educate about pediatric dermatology, but we've blossomed in the last 8 years or so now to more than 1,000 members and many meetings that go on throughout the world in between these world congresses that bring education, particularly to lower and middle income countries where there may not be organized structures.
Definitely. And I think that's why it's so important to have channels like this, where having you even just speak on Zoom and for us to be able to put it out on social media is really important to kind of reach different communities that might not know a lot about pediatric dermatology. What are your thoughts on just having sort of pediatric dermatology information disseminated in different languages? Like, why is that so important for communities?
It's critical. Even though the world language is English, we have to recognize that it's not so easy for many practitioners around the world for whom that's not the native language. Of course, we have webinars every quarter in English. They're all available online for members of the society. And we have other information that's posted, interesting cases, for example, and yet they're all in English. And that's why it's so important for us to start thinking about how we can reach other corners of the world or individuals who just can't speak English that well.
Agreed, yes. And our page, we're starting off with the most common languages, which are English, Spanish, French, Arabic, and Hindi. So those are the ones that we're starting with, but our page hopes to branch out to Tagalog, Portuguese. We've recruited many translators, so the more the merrier is what our team is trying to aim for. And so talking a little bit away from ISPD, but more about peds derm, why do you feel that it's important to treat kids early for pediatric dermatology?
There are many reasons to first recognize what's going on in a child and then be able to treat. And of course, it's very hard to treat if you can't diagnose what's going on. And in fact, we're getting to the point where we don't want to just make a diagnosis, but we want to even dig down to the molecular basis because that's leading to new therapies that are very targeted. So many pediatric disorders are present at birth or present during infancy. Of course, others may start during childhood or adolescence. But if we're talking about a genetic disorder, for example, that's often there at birth. And it's important for the family to have an understanding of the prognosis and what to expect. And of course, if there is a therapy for it, and there are increasing numbers of therapies for our various skin disorders of children, we want to be able to choose the very best accessible, affordable treatment for that particular child.
Do you feel that there's any strategies that you personally have as a practitioner that you use to involve children in their own care more than the families, but how do you get the kids involved in their own care?
It's critical to get the kids involved, whether that's walking into the room and playing a little bit with the baby as the first thing that you do, that automatically creates that trust within the family, or chasing after a little child and playing a little game for a minute before we get started, or sitting there and making sure that when you're talking to families, you're not just talking at the parents, but that you're engaging everyone, including that older child or adolescent whom you very much want to feel in control of his or her disease and engaged in whatever therapy and therapeutic decisions we are making. Now, in each room that I have a little chair, very short, and I will purposely often choose that chair, particularly when there's a younger child involved, so that I can feel ready to speak at that child's level, not just at the level of a parent.
Okay, so I'm assuming tiny chair sales will really increase after this interview goes live because that seems like the solution to having.
Possibly. I will say, though, sometimes I sit in one of those little chairs and the child says to me, "That's my chair." And I'm very happy then to get up and trade.
Great. So when you interact with your colleagues around the world in pediatric dermatology, do you notice any similarities or differences with some how you guys approach treatments or how you approach different diseases or how you approach children? Is there a difference, or have you pretty much noticed a standard across the board?
What's very interesting is that the approach to people is often very similar. No matter where I go, if I go someplace where we're interacting with patients, pediatric dermatologists on the whole, pediatric practitioners tend to be very child-centric, very family-centric, very people-centric.
Mhm.
So that gravitating towards the family, that listening, that engaging, that gaining of trust is a tool that I think we all naturally use because that's what we're like as people. And that's the very first step towards having a successful relationship. In terms of the treatment used itself, there are some differences from place to place. Obviously, we have different medications in this country versus that country. Even topical steroids, for example, can be quite different from place to place, let alone the availability of some of the newer and more costly medications in a country like the United States versus another country that we care deeply about through the ISPD.
Definitely. And when the ISPD is disseminating information about these differences in treatments, do you think that an approach should be to sort of recognize that in the information itself and tailor the information to the country, or is it our obligation to show all the treatment options regardless of what country they're in?
I don't think we want to leave out newer treatment options that reflect our understanding of the pathogenesis of disease. And hopefully, over time, these will be available everywhere. But at the same time, the ISPD has tried to be very sensitive
Mhm.
to the lack of availability of certain medications in so many places around the world
Mhm.
that we want to reach. And therefore, our webinars, our discussions have really not focused on just those expensive new medications, as exciting as they may be, but rather on the broad range and the value of some of the less expensive medications that we've had for a long time as well.
On that tangent, is there any other recommendations you have for how people, specifically non-medical people, parents and patients, can get involved in our world of pediatric dermatology?
There are so many support groups that we very much are partnering with or want to partner with around the world that are speaking to the lay public, family conferences, educational information. And we as an organization would love to do more to partner with support groups in countries around the world. I think that's one of the best ways for parents to get involved and to meet us, because many of us try to go to some of these conferences.
I agree. I think the support groups in different languages too could be great. Just whether you're in this country or if you're in America, if you're across the world, any type of support group would help. I guess last question is just, do you feel that there's an approach to treating chronic skin conditions versus acute skin conditions? Like, is there a difference in how patients should sort of stay committed to the care for the rest of their life if it's a chronic condition?
So many of the skin conditions that we treat are chronic.
Mm-hmm.
And in fact, they often come to a dermatologist because they're chronic. Now, in the ISPD, we are very inclusive. We have members who, of course, are pediatricians or nurses or scientists, a wide variety of individuals who all come together with the common goal of helping children who have skin diseases. But chronic conditions are really more than anything else that affect quality of life, and that affect not just the quality of life of the child, but of the family as well. So we need to think not just about acute, but very importantly, about how to manage chronically, because there are medications that we don't worry about using for a short period of time. That's easy. As I say to my patients, the art is in maintaining disease control, because there we have to walk that fine line of using something that may be too strong for longer term use as needed, but finding tools to maintain control in between with safer medications. And fortunately, we have tools, whether it's intermittent use or whether it's changing the strength of a medication, or whether it's substituting something that will be safer for the long term, but perhaps not as effective for the acute flare of many of our chronic conditions. And this is where we as healthcare specialists really make a difference in educating and working closely with families to figure out for that individual patient with a chronic skin disease, what is the perfect recipe.
Would you say that's why that follow-ups are so important? Like, it's not just about diagnosing and giving that initial treatment. It's important to have continuity of care throughout clinics.
Yeah, you're spot on in saying that. That's why developing a relationship and having an opportunity to follow up, whether it be in person or whether it be maybe through some kind of a telemedicine mechanism, is critically important. When I send a patient out, for example, who's a new patient with atopic dermatitis, I can tell them what to do at that time. And I can perhaps tell them, well, in the next month or two, this is how I want you to adjust. But I have to see them back. I have to know what happens in order to then say, you now fall into this kind of a patient who's responded, or that kind of a patient who still needs more, and we can go the next step. But it's very much with chronic disease on an individual basis.
I love that you touched on teledermatology, because that's such a valuable tool we have today. Why do you think we need more pediatric dermatologists? Why should people apply to be a pediatric dermatologist?
I can't even imagine that we would ever fill the need for pediatric dermatologists. A long time ago, there were no pediatric dermatologists, and no one realized how valuable the pediatric dermatology input would be.
Yeah.
But back in the 1970s here in the United States was when pediatric dermatology first came out. And now it's in such demand that You can add a pediatric dermatologist and they'll virtually instantly be filled, because this is not taught well in our classes, whether we're talking about pediatrics or dermatology. So having this kind of expertise is just invaluable. Right now, we have 30 some fellowships, for example, in the United States, and they're never totally full.
Right.
Really have a deficit here in the United States. And then when you think around the world, in other countries where there may not even be a single pediatric dermatologist or just a handful, even,
Mhm.
it's not enough to meet the need. We need to train we need to train the next generation of individuals who are going to then train the next generation, so that over the next century, we will finally have enough pediatric dermatologists to meet the need around the world.
Definitely. Yeah. Keeping the generational knowledge going is important. And then the two pathways I've heard for pediatric dermatology, you touched on this a little bit, a traditional dermatology residency followed by a fellowship. Could you sort of touch on if a lot of pediatricians then later apply for dermatology residency? Is that a really common route, or is that something that a lot of pediatricians do?
In the United States,
Mhm.
we have a very different situation from what we have in Europe, from what we have in Africa, from what we have in China. And in the United States, we're one of the few places that actually has a formal training track in pediatric dermatology and board certification. And that just came for the first time in 2004. That track does require someone to be trained in at least the 3 years of dermatology, and then take at least 1 year of fellowship training in pediatric dermatology. So it does require that if you've done pediatrics before, you still then have to take a dermatology residency. Now, that's not necessarily how it's done in other places. And if we're going to have a shortage, and particularly in countries without so many fellowship programs and a formal track, we must really welcome people from all walks who want to take that extra time to learn about pediatric dermatology and then provide that service.
It's always good to
And
have.
I have to say, I don't know the kind of curricula that they have in other countries. I know that even in the United States, our curriculum in dermatology is inadequate. General dermatology, let alone pediatric dermatology, and that more people are taught by people who are not trained dermatologists, for example, about how to take care of eczema or how to take care of lice or scabies or skin infections, than true dermatologists. In other countries, most of the teaching, most of the knowledge, most of what is shared is not even done by dermatologists. And the curriculum is probably even smaller. And yet, several skin diseases of children are up there among the most common.
I think more students should attend the webinars and sort of just get an idea of what education around the world looks like and what they've learned from their cases, because it's a very one-sided view to only sort of train here. And it's always good to listen to practitioners from all around the world.
Well, we need to find avenues for that. We've started a new regional committee at the ISPD, where we are getting into every single region in the world, connecting with other organizations, connecting with people who will be representatives, and providing that liaison. And I would challenge our medical students here in the United States to engage in networks of other medical students everywhere and get them involved in being aware of the ISPD and its webinars, and then reaching out as well around the world through the medical student population
Yeah.
and helping us to get more training going on in pediatric dermatology.
Definitely. All my medical students, if you're listening, you heard that. Everyone sign up, follow our page. Well, thank you so much, Dr. Powler. I really appreciate you taking the time for this interview. I will hope that we have comments below, any questions for you, and I'll pass them along via email. But anything else before we end the interview?
Well, I want to thank you for taking the time to do this interview and promoting our mission, which is to try to reach so many out there who are providing healthcare for children with skin diseases. And it's only through this type of social media approach that we can get to all corners of the world. So thank you.